Dr. Stephen Hayashida came to Guam 6 years ago, agreeing to join the Guam Memorial Hospital's medical staff as a neurosurgeon, providing on-call coverage for the first 21 days of each month in exchange for $30,000 a month. He came with more than 2 decades of experience in general and pediatric care and was board eligible but not board certified in the state of Hawaii. And for the last 6 years, Hayashida has been paid $360,000 annually. According to an April 2011 file story, the hospital's previous chief financial officer, the late Siva Karupin, expressed concerns about what he said were exorbitant contracts, such as Hayashida's, claiming the hospital wasn't getting its money's worth. At the time, Karupin confirmed that the neurosurgeon, who only works 21 days out of the month, had only performed 8 surgeries in 2009 and 2 in 2010. This despite receiving the full amount as per his contract. Now, just last year, Dr. Hayashida reapplied for privileges at the hospital and indicated that in the last 2 years he had performed 20 craniotomies and other reconstructive procedures on the skull, another 10 reconstructive procedures on the spine, and 10 surgeries for intervertebral disc disease and back surgery on island at GMH. Since his contract began in 2007, Dr. Hayashida has been paid more than $2.2 million from the Guam Memorial Hospital, whether he performed surgeries on island or not. But KUAM has learned that Dr. Hayashida was drawing more than one paycheck from the government of Guam. In fact, based on requested information from the Port Authority, the neurosurgeon also received more than $167,000 from the Port Authority for evaluations and surgeries he performed on injured port employees over the last 7 years. It was only after the port's previous management had authorized the payment of some $77,000 for medical and travel expenses for former Port Marketing Administrator Bernadette Stern-Meno that information surfaced about Hayashida's relationship with the Port Authority. Meno's travel expenses and per diem costs, along with her escort, were pegged at more than $10,000, in addition to the $66,000 in medical expenses. The travel request and authorization were red flagged at Adelup, and the trip was eventually canceled. Now, the request prompted a full-fledged investigation into Meno's work-related injury claim and the subsequent workers' compensation leave she had received that was later reversed because a claim had never been certified by the Workers' Compensation Commission. In a July 2012 email, Meno requested that the port safety officer refer her to Dr. Hayashida for further examination relative to her slip-and-fall incident in the port's bathroom just 10 months before. And a September 2012 email from former Port Personnel Services Administrator Francine Rocio indicates that the Port Authority had a closer relationship to Dr. Hayashida. Rocio writing in an email to Meno, quote, "We are fortunate to know him and have him as our very own personal surgeon for the port." When asked whether the agency has a contract with Dr. Hayashida, Port General Manager Joanne Brown says she isn't aware of one.
On this particular case, we have no formal contract with him. So how that came to be is a very good question. I think needs to be further looked into.
Brown also could not explain how Hayashida had been selected or referred to handle the cases of 7 injured port workers.
As far as the port, what information we've looked at, we're not aware that this procurement has gone through the proper procedures with regards to procurement. So certainly it's something that we're concerned about and that we're looking into.
Because the agency does not have workers' compensation insurance, which is mandated by law, the port has chosen to self-insure, which resulted in the agency paying out close to $500,000 for the evaluations, surgery, and hospitalization of 7 injured workers who traveled to Hawaii for the procedures. Another $33,000 was paid out for the anesthesia related to the surgeries performed by Dr. Hayashida. The $425,000 the port spent in the last 7 years does not include the additional taxpayer dollars that were spent to pay for the airfare of the employee and their escort, as well as per diem costs while in Hawaii. While the port is prohibited from disclosing the types of surgeries that were performed on its 7 workers by Hayashida, we should note that there is documented evidence from the hospital that Hayashida has performed many surgeries on Guam, including more than a dozen spinal fusions and low back disc surgeries. Could the nearly $500,000 the port spent to send their workers off island for surgery been done on Guam?
I don't know the answer to that. I mean, it might be very possible. I mean, that's something, individuals that are in the medical field probably have more expertise, but I'm sure all of those things could have and should have been looked into to ensure that, the service could still be provided to the patients, ensure that their health and well-being is addressed, but at the same time also ensuring financially that the cost that's being paid is a responsible payment.
We attempted to contact Dr. Hayashida to get answers to our questions about his arrangement as the port surgeon and why surgeries for port patients were done in Hawaii rather than Guam. The hospital said he is not currently on call and calls to his Hawaii office were not returned as of news time. Reporting for Guam's News Network, I'm Indy Egan.